It has been 1 year since the first COVID vaccines were administered here in Michigan, and a lot has changed since then. We went from mass clinics like the DeVos Place to availability right in your doctor's office. And Dr. Mark Cleland is a critical care and pulmonology physician at Spectrum Health and was one of the first people in the state to get the vaccine. He joins us now with a little insight over the past year and, of course, looking ahead for the next 12 months. So, what has your experience been with this vaccination and how it's affected care for patients?
Yeah, that's a great question. What a journey it's been. Hard to believe it's been a year since the first vaccine. Certainly, it's been a learning curve for all of us. When they asked me if I'd become the first to be vaccinated, I said without question yes. After everything that we had been through, and for many people, people were very quick to roll up their sleeves and get vaccinated. As time has gone on and we've gotten smarter, we have learned that the vaccine is incredibly safe and incredibly effective. Most of the people that we're seeing in the hospital who are very sick with COVID, unfortunately, are people that are unvaccinated.
The National Institutes of Health did a study on how COVID physically changes the lungs for good. And as a pulmonologist, I'm sure that you have witnessed changes like this in your patients as you treat them, understanding and underscoring the importance of vaccination, because you can't go back once you've damaged the lungs from COVID, according to the study.
That's correct. That's correct. I'm glad you asked about that. A lot of what we're seeing is long-term effects of COVID. Surely, we're seeing a lot of people who don't make it and sadly pass away from COVID. But even those who do survive often are left with long-term consequences. And I think that's important for people to understand. It's causing lung damage that often is requiring people to remain on oxygen even after they leave the hospital. It's causing a lot of disability. It's causing other problems even beyond the lungs. We've all heard of COVID brain, people who have long-term neurologic sequelae. I've seen a lot of patients who aren't able to go back to work afterwards, for example, and have a lot of disability. We've seen it cause kidney problems and just a host of different issues. Oftentimes, after people are in the intensive care unit, they're incredibly weak and debilitated, and often need to spend weeks, if not months, doing rehab before they can get back to life. So, for all those reasons, I would really urge people to think about, please get vaccinated. So that you can not have to go through that, and you're much less likely to suffer any long-term effects. And certainly your family and your loved ones want you to be well and want you to be safe as well. So give yourself a gift this holiday season and get a vaccine.
All right. Well, thank you so much for this conversation. And if you would like to read more about Dr. Cleland's thoughts on the vaccine in this last year, I have posted his op-ed on 13onyourside.com.
Thank you.